What You Should Know About the Affordable Care Act by George Butow, Michael Doherty, Sam Hall, and James McCauley. Teddy Roosevelt began efforts of universal coverage in 1912 alongside the support of progressive health care reformers. Roosevelt ultimately lost the election and the program was not passed. Following the Second World War, President Harry Truman called for universal health care as part of his Fair Deal in 1949, but strong opposition stopped that portion of the Fair Deal. In 1965, Lyndon B. Johnson passed Medicare and Medicaid programs that ensured some insurance to the elderly and the poor. As of the 21st century, there are still 48 million uninsured people. There are many different aspects of the Affordable Care Act. For instance, there are three insurance standards that insurance companies will have to follow. Children will be able to be on their parents' health care payments until the age of 26. Second, insurance companies will not be allowed to force patients off their care if they become injured or ill, and the price is too high for the company. The third standard is that insurance companies cannot deny policies to those that have pre-existing conditions, which in the past these patients could have been denied. When people are exchanging their health care, the ability to do that will be done through the state. The state is funding its own program and runs their own website. Patient guarantees are another aspect of the ACA. Essential benefits that patients will receive are the luxury of not having a copay. Without this copay, it will be causing the insurance companies to pay more money. Also, the insurance companies will not be able to limit the amount of coverage on a patient's care. In programs such as chemo and dialysis, there are many different expenses, and in the past, insurance companies could have potentially ended patients' coverage. Individual mandates under this new program are that the government and wealthy people will be paying more to support those who cannot pay in full for themselves. If someone decides not to pay for the care, they will be taxed in order to make up for the loss of that individual's payment. Subsidies under the new Affordable Care Act will be given to those who cannot afford the coverage. The wealthier people will be paying for those subsidies to help avoid higher tax rates. Medicaid expansion will be given to people that are 138% above the poverty line. With this new expansion, people considered in the lower middle class will now also be assisted because in the past they were not. Medicare payments will be assisted by ACA to help the elderly and retired. Under the new program, the money will be pooled for efficiency. With the pool of money, coverage will be given to those who need more. Also, doctors have been instructed to give these people better care with the mindset that if they work harder now, that in the future these elderly will not be returning with the same problems. This part of the ACA is helping the doctors increase profits because they will not be taking a loss on the multiple visits. One last aspect of the new ACA is the employer mandate. This is for the small business owner that might not be paying their employees enough money to afford the ACA. These business owners that do not give health care to their employees will be paying very high taxes because of this. On the first day that the ACA website was open, there were many different issues with it, mainly confusion by those who logged on. If you notice the graph, almost 9.5 million people went to the website and only around 36,000 could actually completely apply for the care. This was a huge problem for the website, which racked up $292 million in damage on the first day, while the original website budget was supposed to be $93.7 million.
Some unintended aspects we would like you to know about. With the new ACA, there are self-funded plans that are going to need more guidance because the Department of Labor hasn't made enough rules for them. Next thing we would like you to know is that the criteria for employee eligibility for the ACA could change, and that's risky to mess around with because it determines whether employees are full-time or part-time. The next thing we would like you to know is that the costs and regulations could change the benefits of the ACA as a whole, and that could include department work and payroll. Now we'd like to talk about the 4 ways you could be covered under ACA. First of all, half of employees will get insurance to their jobs that they currently have. A third will be covered by the government under the ACA. 1/10 will be covered by purchasing their own insurance, such as the new marketplaces that the ACA has, which are private insurers. And just about 30 million of Americans won't have coverage at all, which is just under 1/10. Some cons we would like you to know about the ACA. Under the new ACA, there's expansion with Medicaid, using federal and state funding. However, with this expansion, not all states are required. However, if the states don't expand, the amount of people that are covered under the ACA will decrease. If the states do expand, though, the feds will cover most of their costs. And those who don't decide to expand will simply be left with the same options that they had currently. Some pros we'd like to talk to you about under the ACA. The advantages that are going to happen is that the caps on the amount of money you have to pay out of pocket are going to stay the same. You will have free preventative care. Insurers can't inflate prices if employees are sick. Nothing will change with senior citizens. Medicaid is expanding to cover more adults in poverty. Men and women will pay the same price, and older people will pay less, but the downfall is that us younger citizens will pay more. Under the ACA, the people have a very high influence. The costs are uncertain, and if people don't sign up for the ACA, the costs will simply increase. Some people will decide to not get health insurance at all and simply pay the violation for skipping what is called the individual mandate. If you can't buy into the insurance and can't get anywhere else, however, the government will waive the penalty. What some people will actually do is they will drop and add the ACA as they feel they need it. Instead of having it all the time, they will simply just buy it when they feel they need it the most. Under the ACA, there's going to be new customers, obviously. With these new customers, they don't truly know what they're investing in with this new plan. So what's going to happen is the healthcare providers are going to need to educate them. They're going to simply need to explain what the benefits are and how they can access them. However, with that occurs administration costs, and they're going to rise. They're going to rise because new customers means more customer service for the employees.
The Affordable Care Act will provide protections to consumers by eliminating canceling policies by insurance companies so that consumers won't be dropped from coverages, while also giving these same consumers doctor choice and easier access to emergency rooms. The act also forces health insurance companies to provide essential benefits for all consumers, regardless of their pre-existing conditions, and also completely eliminates the pre-existing condition rules where insurance companies could deny people coverage for their pre-existing conditions. The ACA also offers a Medicaid expansion program to low-income Americans. Although this expansion is not mandatory, it could potentially make 16 million Americans eligible for Medicaid. States that choose to expand their Medicaid program could have 100% federal funding for the first 3 years of the program if they chose to do so by January 1st of this year. The expansion will help cover low-income Americans who could not previously afford to buy health insurance by putting a tax on higher-income Americans who can afford to do so. These funds will go to help promote better funds and care for primary health care physicians, and also increase incentives for doctors to accept Medicaid. The potential consequences of the Medicaid expansion could lead to less spending from the upper and middle class because of their higher implemented tax rate. States who don't expand their Medicaid program could be hurting Americans who can't afford to buy health insurance, but at the same time are mandated to under the Affordable Care Act. This increases the size of the stakeholder group to all Americans who live in states who don't opt into expanding their Medicaid program, as well as the upper and middle class, because of their higher tax implementation, and insurance companies who will have to spend more to cover patients with all types of conditions.
How ACA will affect the job market. It is estimated that ACA will decrease the labor force by 2.5 million jobs. With the new regulations regarding employee benefits, there will be more part-time jobs and less full-time jobs. This will cause employers to alter how they value employees, and which employees will be kept on as full-time and which ones will be moved and decreased to only part-time work. After a company reaches 50 employees, they have to provide health insurance for all full-time employees. Due to this, many companies will stop hiring before reaching 50 employees in order to save money on the cost of health insurance. ACA's effect on the cost of living. With companies having to pay more in taxes and expenses, this will create an increase in cost of doing business. This increase in cost will cause prices for consumer goods to increase for everyone purchasing in the market. Under ACA, having a college degree is not going to guarantee you a good job out of school. In many situations, you will have to settle for a part-time job in order to pay for your expenses. Having less chances to make a livable income out of school, young adults will have to live at home with their parents for longer than is currently done. This puts an added strain on parents with the cost of living. The chart to the right shows the most popular changes that will be taking effect with the Affordable Care Act. As you can see, the majority of people both know what is incorporated in the act and, in fact, favor all of the alterations to the current law. In closing, these are only a few of both the positive and negative unintentional consequences linked with the Affordable Care Act. We appreciate your time and hope that we've been able to give you a brief look into what the Affordable Care Act is and how it can potentially affect all Americans.